welcome to Ask John. This is the show where John invites interesting people to ask him questions. Now, that's why it's called Ask John. But since they are the interesting people, John tries to ask them questions because they have a lot more to say than I do. And I'm John Reuscher, and welcome to the show. Today we have Cindy Eisenhower, CLTC, joining us. She is an expert in the long-term care field. She's been in that field for 27 years. Cindy, what does CLTC stand for?
Certified Long-Term Care Specialist.
Okay. So it must be CLTS, Specialist. CLTC. Anyway,
Yeah.
Doesn't matter. We'll sort it all out.
Alphabet soup, John.
Cindy has been on several legislative committees for the California Long-Term Care Partnership Task Force and for the Alaska Long-Term Care Committee. She was an industry expert for them, and also in the state of Hawaii. She's also an instructor for continuing education for those people who are licensed to sell long-term care insurance. Today we're going to talk a lot about the issue of long-term care, not necessarily the insurance, although that is a big part of it, but as a financial planner, as a financial advisor, that's one of the things, that's one of the things that often gets overlooked, but it's very important, and I can tell you that my clients don't overlook it, I just don't let them. It's a big part of the financial plan, and sometimes the insurance is there and sometimes it's not. There's a lot of things to consider in all of that. But let's start with Cindy. You've just started an advocacy website. It's easy for me to say, an advocacy website to give people access to help when they're looking for care.
Yes. One of the things I found in this long and storied career, if you will, is there are so many people that need access to caregiving resources. They may need advice about something that they purchased, a long-term care insurance policy or something else that was supposed to be there to help them. They may need help getting on claim. They may need help just looking for long-term care resources. I tend to get phone calls every week from people that don't know where to turn. So I have a wonderful partner who helped me set up a website that is free to the public to go, and we're there to help them find the resources that they're looking
Excellent.
for.
What is that website?
It is www.longtermcareadvocacy, all spelled out, .com.
longtermcareadvocacy.com. So I think everybody has an idea what long-term care is, but there must be a specific definition. What is long-term care?
What is long-term care? I get this question all the time, and it's not what a lot of people think it is. If I ask you, John...
What do I think it is?
Well, let me ask you.
What do I think it is?
Have you ever needed long-term care yourself?
I have not. The prospect does scare me. But you do. I know you do conjure up the images of nursing homes, and I know that it's a lot broader than that.
Well, that's why you answered that you hadn't needed long-term care, but the truth is that you have. And so have I. Because we've done the research, we found out you were born. And so was I.
Well, I had knee replacement.
The day that you were born, you couldn't perform what we call your activities of daily living.
Oh, there we go.
You
Okay.
couldn't bathe, dress, toilet, transfer, maintain your continence, or feed yourself. And you needed supervision. All babies need supervision.
So these ADLs, these activities of daily living, is what, that is the definition of care, of long-term care.
It's part of it. You may also need care because a baby needs supervision because of a lack of experience. An adult might need supervision because the computer chip has slowed down a little bit, what we call cognitive impairment. So for those two reasons, you may need somebody with you to help you with the things we just take for granted.
And the basic supervision, so we don't just walk off, which we hear about people doing that, just walking away.
Yes.
Yeah.
Yeah. So long-term care is assistance with your activities of daily living, or it's supervision because of a cognitive impairment, and it's the things we take for granted. Custodial care is really what long-term care is and how it's defined.
Okay, so that can be home care, or it could be different types, different levels.
Really, it doesn't matter where the care is given. It can be in your home, it can be in a facility, adult daycare facility, it can be anywhere. The care itself, we often, when people hear long-term care, they do what you did. They think about being older and being in a nursing home. But the reality is that this is the type of care that you could have needed after a knee replacement. You might need it if you're in an accident. You might need it if you have a degenerative disease. It's just assistance with your activities of daily living or supervision. It can be hands-on, where somebody's actually touching you to help you, or it can be standby, so they're just there.
So who, other than newborns, who is likely to need that kind of care?
We all remember Muhammad Ali. He was the
yeah.
greatest, remember?
Yeah, the
He
great.
developed Parkinson's disease and ultimately needed care for the long term. Pat Summitt, the coach of the Lady Vols, developed Alzheimer's disease and ultimately needed somebody's assistance. Christopher Reeve, Superman, fell off a horse, beautiful spring day, and would need care for the long term for the rest of his life. So age, because they're not the golden years, as my mom says, they're the rusty years. Age is one of the biggest contributors to the need for long-term care, but so is accident and so is degenerative disease.
So what are the chances that anyone in particular would need care?
Well, how many of us in this room plan to get older?
Well, there's just two of us in this room right now.
I
so
think we're both planning to get older.
I have no plans. I have no plans to get older. No.
I do.
My plan is to get younger. So
There's all kinds of
so
statistics.
I'm the man in denial. But there's a lot of statistics. And,
There's all kinds of statistics, but in reality, who's going to get older? Who could be in a car accident? Who could get Lou Gehrig's disease or multiple sclerosis? The reality is, as human beings, we think we can control everything, but we can't.
Yeah.
We don't know. Anybody could need this type of care. You said knee replacement. Some people need a shorter type of care for an operation like that. You were able to recover and get well, but degenerative diseases don't get better. Long-term care services will help to maintain you as you get worse or keep you the same as you are. Strokes, some people with heart attacks, Lou Gehrig's disease, Alzheimer's disease, Parkinson's disease. My dearest friend in the world is in skilled nursing in San Francisco. She has the elephant man's disease, a very pronounced version of it, and she is completely paralyzed except for one hand, and it's been degenerative. She's 57. So
It's too young.
it
It's
is
too
way
young.
too
Yeah,
young,
yeah.
way too young.
Yeah.
So you just don't know. Statistically, X amount before the age of 65, 37% of the people in nursing facilities today are under the age of 65. Not a big surprise, because I think the next option on a car will be a microwave where the glove box used to be. You could cook your breakfast, eat your breakfast, do your makeup, and drive to work while you're texting.
All kinds of stuff. Yeah, that brings to mind this thing that we talk about in investing is this exponential technology and what's happening there, and it's affecting us in all kinds of ways, not just in terms of how we would invest in these technology companies, but how we live and how we're going to live longer. And we're likely, some people are saying we're likely to live longer and more healthy because medical technology is exponential also, and there's huge improvements. And so it changes my whole planning concept, but also changes the way I think about how I might live. You know, I hope that I don't have a degenerative disease that would require me to need care, but I need to be prepared for that. But also, my clients and I need to, and my clients need to be prepared to live a long life and still in a healthy, happy life. And so, if you haven't accumulated enough money, you must do that, or you must have a plan to do that, and that's what I do in my work. Mm-hmm. So, if we end up needing care. Typically, who provides that care?
Well, typically it's what we call an informal caregiver, who is somebody who loves you. Initially, it's going to be a spouse or a partner. It could be a child. It could be a daughter-in-law, son-in-law. Women tend to do the less than desirable things, so a daughter or a daughter-in-law will help with your icky stuff. But
it's usually the daughter, isn't it?
It is. Yeah. It's usually a female in the family, but men are also involved, and we don't recognize this in that somebody's still got to cut the grass, pick up the groceries, get the prescriptions, sort of the instrumental activities of daily living. And if you think about it, you know, how tall is mom and how much does she weigh? Can your significant other, realistically your daughter maybe, or your spouse, your wife, pick her up, or is that really going to fall on your shoulders? So yes, women tend to be more involved day to day, but the men in our lives are as well.
You were talking before about how the healthy caregiver ends up sick.
That's exactly right.
Injured, perhaps?
That's exactly
worn
right.
Out?
Yes.
Yeah.
More women tend to need long-term care services than men, and for a longer time, and that's because traditionally and probably forever they are the caregivers. It's not the sunrise of life that we talked about initially with babies. This is the sunset of life, and no one wants to admit what the end result will be, so we do our best to deny what's taking place and fix things. And you're right, the healthy spouse, the healthy child, the healthy person, because it's not only physically straining, it's also emotionally straining, and it can also be financially straining. The one thing we didn't talk about is that sometimes when you have someone you love that needs care, it's the children that have to step in and help financially, because the parents, mom and dad, run out of resources if they haven't done some planning to pay for this.
It's a lot to think about. Yeah.
It is.
Yeah, and I'm thinking my own situation. I have a sister who's quite involved with my mother. My mother doesn't need care at this point, not at that level. But she's 93 and still, she's still there anyway. She's still there, and she's just as sharp as can be. And my sister lives close, and she does take care of her quite a lot.
So
and I help my mother with the financial stuff. So I'm doing my part.
If you think about it, God forbid, what if something changed because she lives closer? So it would fall mostly on her shoulders.
Yeah.
And then the other thing we didn't talk about is then how do you as a brother feel? There's the guilt that you then feel because your sisters do. It's like a pebble in a pond with ripples everywhere, which is why it's so important to have a discussion with someone like you, a financial planner, and have a plan. If you have a plan, then everybody knows what the expectations are.
It's amazing, isn't it? Let's see. The estate planning and the long-term care planning is not is not for the subject. It's not for my client. It's that planning is actually for the client's loved ones, the people who care about that person. It's a whole different conversation.
It's the same thing.
Yeah.
Long-term care planning is really, you know, if you're one of the lucky ones and you're cognitively impaired, you won't even know you're getting long-term
Yeah.
care. But the
Yeah.
people that love you are the ones you
Do
protect.
you find people resistant to the conversation about it?
Unfortunately, the media is not kind to long-term care plannings, and there are a lot of misperceptions. So yes, I would say at this point, people are resistant, but they are less resistant than they were 10 years ago. And I think that's a direct reflection of how many baby boomers have elderly loved ones that they're watching go through the process, and they're beginning to recognize how important it is for their loved ones that they do have a plan in place. So I would say that it's beginning to change. I like to say the tail is beginning to wag the dog.
Oh, good. And you were saying that people tend to seek professional care anyway. They wait too long to do that. Why is that true? And what?
Yeah, absolutely. What happens initially is it's always somebody that loves you that steps in. I had a wonderful experience many years ago actually working on a claims desk, and it was wonderful because it taught me so much as an educator. My husband is a very interesting man, and he has 2 policies because he's an interesting man. And because
2 long-term care policies.
Yes,
yeah.
and because if I had to bathe and dress him, I'd need a crane. He's twice my size. But when the husband or the wife or the partner, whoever it was, the son or daughter was calling in, I realized they should have called in much, much sooner. And the reason that they didn't was denial. They did not want to recognize what was going on, and they did not contact us until they didn't know what else to do. And when that happens, they need assistance immediately. They need resources. They need to know what to do. For the most part, they are exhausted. So it's been an informal situation for some time, and oftentimes we can continue that, but with a formal caregiver, to your point, that would come into the home and be there to help. And then sometimes things escalate, and also depending on the people. Men tend to want to stay at home. It's that Mars-Venus thing. You know, you don't want to go somewhere. You want to be in your own home. Women tend to do better, I like to say, in captivity. You know,
women do better in captivity.
We do. We like to sit around.
I'm not sure you can say that.
Well, we like to sit around, sing Kumbaya, hold hands, and that sort of thing. You guys not so
You're more
much.
social. Women are more social.
Exactly.
Yeah. No, they don't want to be. They don't want to be captive.
Well, you go to assisted living and they make your bed and they cook your meals, and you've got the remote control for the first time in 40 years. It looks pretty darn good.
Yeah.
But you could do that. You could move on to an assisted living facility, and then in some cases, end-of-life hospice is another type of caregiving. Skilled nursing facilities. We now have adult daycare facilities. Some states have what are called adult foster homes, which are a little bit more intimate, smaller licensed organizations. So there is a real plethora, there's a real menu of places and care that you can get wherever you choose to get it.
Broad range of care. And all this care is free, isn't it?
No.
Is it covered by insurance? Does Medicare cover it? Does Blue Cross cover it? Who pays those expenses?
Well, there's another myth. People think that Medicare pays for it because it goes back to thinking it's only for older people. Medicare is major medical insurance. The veterans, major medical insurance. Blue Cross, Blue Shield, Health Net, Kaiser, whatever you have, that's major medical insurance. And when we designed that for what's called acute care. Acute care is the type of care you need when you're going to get better. If you've had a knee replacement, that was acute. You went to the hospital, the doctor did the surgery. Afterwards, you rehab for a little bit in the hospital, and then you were able to finally go home and you had a physical therapy appointment. These are the things that are covered with health insurance because it's acute. You break your arm, that's acute. You go to the hospital, they put it in a cast, and it gets better. Your knee got better. Health insurance pays for what gets better. It does not pay for what we call chronic or long-term care. Because long-term care, you're not going to improve. People that have Alzheimer's or Parkinson's disease, it gets worse. People who are older and frail get older and more frail. So long-term care is not paid for by major medical insurance. The good news is that there are a lot of...
You consider Medicare major medical
yes,
insurance?
Yes, that's what it is.
Then you have your Medicare and your Medicare supplement plans, all major medical. Does it cover something? Like, I understand it covers 90 days of something.
Medicare will cover up to 100 days in a skilled nursing facility.
Okay, that's what
There's a criteria to go to a skilled nursing facility that you would never meet if you had Alzheimer's disease, because you have to be in a hospital first. You wouldn't meet that if all you needed help with was
so
bathing.
If you were in the hospital, you went directly from the hospital to a nursing home, then you have 100 days coverage with Medicare or the Medicare supplement plan.
Well, up to 100 days. The first 20 days are paid at 100% of the approved amount. The next 80 days you have a co-payment.
Either way, if it's long-term, your insurance is not going to pay for it.
Correct.
So what does it cost?
Well, the average cost for a skilled nursing facility nationally today is about $92,000 a year.
Wow.
The average cost
Probably more expensive in California, in the Bay Area. Yeah.
Well, we are definitely up there, but we're not the most expensive place in the country.
Oh.
Connecticut and Alaska get that prize, yes.
Okay.
But California is very expensive. Home care is not that expensive. But
would it depend a lot on how much home care you need? If you needed 24-hour care, then it would be more expensive than nursing.
Correct.
Yeah.
That's why a lot of people do make, all joking aside about captivity, that's why a lot of people make the decision to go to assisted living, because it's less expensive than having someone come in the house.
Yeah, at first you may need someone every few days for helping with medication or injections or whatever, and then you need them for several hours. You need someone now overnight. Then it gets expensive.
Well, it does, because in that example you'd need two people. You'd need someone skilled to come in for injections and medically based help. That's a home health care worker, but you need somebody there for the custodial caregiving, because we forget, we don't want to think about not being able to bathe or dress or transfer or feed ourselves.
Transfer, getting out of a wheelchair into a bed or that sort of thing.
Getting up from the couch to go to the bathroom.
Okay. Yeah.
All kinds of things. So we don't think about those things because we don't want to.
Who does?
No, nobody does.
Yeah.
This is a tough conversation.
Yeah.
And I applaud people that have the conversation, because again, when you've had your conversation, your planner knows what your plan is, and there are lots of choices. Some people make the decision to pay for this themselves, and by the grace of the good Lord, they can.
That's right.
Good for them.
Grace of the good Lord and a really good financial planner.
Exactly.
which is the grace of the good Lord. I have to say, whatever I do, I don't take credit.
There you go.
Yeah.
But you know, it's what's important is to have the conversation, make a plan, let everybody know what it is. You've done your job.
So, in general, people are paying for it out of assets, or are they paying for it out of long-term care? I know you can buy long-term care insurance for this. And, You have any ratio, any idea how many people own, you and your husband own long-term care
Oh, yes.
insurance? And so who owns long-term care insurance? Who uses that option?
About 10% of the current population has done some sort of long-term care planning. It could be insurance. It could be one of the newer products that's a life insurance product that's combined
The
with
hybrid.
long-term care. Yes,
Yeah,
sir.
so rather, you have a life insurance death benefit. No one wants to talk about that either, do they? But you have a life insurance death benefit that would actually pay out of the death benefit, would pay the long-term care costs.
Right.
Okay.
There are annuity products that do the same thing. So there's a range of planning. 10% of the population today has done that. 90% has not. Either they're not educated, they don't understand this, they think Medicare pays for it, or they don't want to talk about it. And unfortunately, what happens in that case is they run out of money in a very short period of time. 13 weeks is the average, because the costs are so excessive, and they end up on Medicaid, which we call Medi-Cal in California,
Right.
which is a welfare program.
And you can only be on Medi-Cal if you don't have any assets, or there's a certain amount, what is it, around $100,000, I think, for a couple, other than the value of the equity in your home. Is what they call it, a non-qualified.
It's a non-countable,
non-something.
non-countable or exempt asset.
It's an exempt, yeah. So you can own equity in your home, but if you have any other assets, maybe a car and other things, but if your assets, and I understand even life insurance cash value, it gets thrown into this mix. So if all that stuff adds up to more than $102,000 or something like that, right? Then you can't qualify for Medi-Cal. So you do this thing called spending down, where you reduce it, and then you get Medi-Cal. But nobody wants to be on Medi-Cal. That's not a good plan.
No.
And,
no.
unfortunately, I do have some clients that are kind of on that plan. It's just circumstances, but we still plan. We still plan.
It's an unfortunate reality.
Yeah.
It's funny when I say the 13 weeks. My own mother just moved from Oregon to California, and it took us 13 weeks to go through her assets. I couldn't believe it, but that's exactly what happened.
Yeah. Well, is there anything else you want to add?
Well,
what didn't we cover that you feel compelled to put out there? This is your chance. You're in the spotlight now.
I think the most important message to people is that there are people like John, like you, that you can sit down with and talk about this with and figure out what's best for you, because all shoes do not fit all feet. Not everybody should buy long-term care insurance. Not everybody should buy this or buy that or whatever it is.
Yeah.
There are some people that can afford to pay for this on their own. But back to your point about it's not really for the people that buy it, it's for the people they love. That's what matters.
That's a really good point.
And I think that's today's message, is protect the people you love.
Excellent.
Thank you.
That's a good place to end. I really appreciate you being here. This has been informative, I'm sure, to the people who watch this, but it's been informative to me as well. And it helps me. Maybe this helps me do a little bit better job in my work with my clients, and makes me a better planner. And I appreciate the help you've given me on that. And I wish you luck. Take a look at this website that Cindy has, the long-term care. We'll put that up on the screen here. I'll bet you're looking at it right now. It's probably right there. www.longtermcareadvocacy.com. Take a look at that. I think there'll be a lot of help there. So even if you just have some just a little bit of interest, just check it out. And thank you so much for joining me again on Ask John. We'll be back in a couple of weeks, and we'll have another interesting guest. I'm not sure who that is this time, but we tend to have more and more good guests, interesting people like Cindy, and Thank you so much, Cindy Eisenhower.
Oh, thank you very
And
much, John.
Maybe you'll come back another time.
I would love to.
Okay. Until then.